Bismillah ar-Rahman ar-Rahim. Tuberculosis. Primary pulmonary tuberculosis will include the parenchyma, airway, and the pleura. In the parenchyma, the upper lobes affected slightly more than the lower lobes. There are alveolar infiltrates. Cavitation may be present, but it's rare. Lobar pneumonia is almost always associated with lymphadenopathy, mostly unilateral hilar or paratracheal, and usually the right side. The airway affection in tuberculosis will be in form of atelectasis, and atelectasis classically affects the anterior segments of the upper lobes or the medial segments of the right middle lobe. The pleural affection or pleura will be affected in tuberculosis in form of pleurisy or pleural effusion. The pleural effusion is a manifestation of primary TB, occurs more often in adults than in children, and the fluid accumulates slowly and painless, and will be painless. Therefore, the patients with TB are seldom seen with a small amount of pleural fluid. Parenchymal disease will almost never be present with a pleural effusion, and lymphadenopathy may be. Then post-primary tuberculosis, which means reactivation of the TB. The most cases in adults occurs as a reactivation of the primary focus of infection acquired in childhood. It is limited to apical segments of the upper lobes, or posterior segments of the upper lobes, or superior segments of the lower lobes. May present as pneumonia, cavitation, which is usually thin-walled, smooth on the inner margin with no air fluid level, middle lobe syndrome, bronchiectasis, usually asymptomatic, spillover transbronchial spread may occur from one upper lobe to the opposite lower or to the another lobe, miliary spread, and tuberculoma may occur in either primary or post-primary disease, round or oval lesions with satellite lesion. Formation of the pleural fluid in post-primary tuberculosis is almost always means direct spread of the disease into the pleural cavity and should be regarded as an empyema.